So you have the posterior triangles of neck. We'll be talking about the posterior triangle, which is bound by the sternocleidomastoid and the trapezius and the clavicle below. And the inferior homohyoid divides into occipital and the supraclavicular or the subclavian triangle, where you have the subclavian vessels. Now the roof, we see skin, superficial fascia, platysma, and below that the external jugular vein, which is formed by the retromandibular vein and the posterior auricular vein. And you have the investing layer of deep cervical fascia. Now in this you have a few nerves, which is, you see that you have, if this is the ear, you'll have two nerves going like this. Anteriorly you have the great auricular vein, which is thickened in leprosy and it is also associated with Graves syndrome. And posteriorly you have the lesser occipital nerve. Now the importance of great auricular nerve I'll tell you later. And beyond that you have the transverse anterior cervical nerves and vessels, and below you have the supraclavicular nerves and vessels. Now these four nerves together will form the nerve point or Erb's point, which is best for anesthesia. So these are all seen in the roof. This is the posterior border of the sternocleidomastoid. Now according to, I told you the importance of the great auricular nerve runs along the external jugular vein. It provides supplies to ear lobule, skin over the mandible, and Fraze syndrome, along with the auriculotemporal nerve. Now the floor of the posterior triangle is formed by many muscles. Now what you have to know is that there is a muscle called the levator scapulae. The levator scapulae, on the levator scapulae you have the spinal accessory nerve. This spinal accessory nerve will supply to sternocleidomastoid and the trapezius. Apart from the spinal accessory nerve, which is the 11th nerve, you have from below upward you have scalenus medius, scalenus posterior, levator scapulae, splenius capitis, semispinalis capitis. The content is very important. The first content, you'll know that we talked about the spinal accessory nerve. It's going to supply trapezius and the sternocleidomastoid, which helps in elevation and retraction of the scapula along with the overhead abduction. And apart from, you have the nerves that we learned, the great auricular nerve and the lesser occipital nerve, and the supraclavicular nerve will also be present. And other nerves are the brachial plexus, which is also there, and you have the suprascapular nerve and the nerve to subclavius also will be seen here. And in vessels, you have to know that you have the subclavian vessels. The subclavian vessels will be present here in the subclavian triangle. Also you have an occipital artery, which is a branch of the external carotid artery. All this is very important. This is the dorsal scapular nerve. Now why I'm telling this is very important, because all these things you can derive from here. This dorsal scapular nerve will supply to rhomboid and levator scapulae. So rhomboid major, rhomboid minor, levator scapulae. All these, it's going to go back and it's going to supply the muscles of the back. So this is the posterior triangle. Now the anterior triangle. The anterior triangle, it has four triangles. It is divided into four triangles. Now the first one is the carotid triangle, and the second one is the digastric triangle or the submandibular triangle, and the third one is the muscular triangle, which is stap muscles are present, and the fourth one are the submental triangle, which has only submental lymph nodes. So first we'll be talking about carotid triangle. Carotid triangle, it has skin, superficial fascia, and platysma on the roof. Now once you go down, what happens is you have to see the contents. The contents, how is it? First it's bound by superior belly of homohyoid. See, it's going to go like this, and beyond this you will form the posterior triangle. Superior belly of homohyoid, anterior border of the sternocleidomastoid, and the posterior belly of the digastric. This forms the sternocleidomastoid. The contents is, you have the carotid sheath. So the carotid sheath, you'll have a common carotid artery, external carotid, internal jugular vein, and the vagus nerve. And the vagus nerve is the content. And the external carotid artery will give rise to 5 branches: superior thyroid, lingual, facial, occipital, ascending pharyngeal artery. And apart from that, you have from associated with the carotid sheath, posterior to the carotid sheath, we have the sympathetic trunk, and you'll have the ansa cervicalis, and you have other nerves, that is 9, 11 and 12. Now the 11th nerve, which is the spinal accessory nerve, it's also a continuation of the it's also a content of the posterior triangle. So that you should remember. It's going to come like this, cross, go towards the posterior triangle and supply the sternocleidomastoid and the trapezius. Along with that, it's going to supply the sternothyroid, sternohyoid and homohyoid. It's also going to supply that. Now, the tongue, from the 12th nerve is going to supply the tongue. It's also going to come here, and also you'll have the 11th nerve and 12th nerve there. So 9th nerve also is going to be present. So next is digastric triangle. Digastric triangle from superficial to deep, I'm going to tell. So if this is the tongue, you have the superficial deep, the submandibular. Okay, so you have the mylohyoid here, and deep that you'll have hyoglossus. Now, superficial to mylohyoid, what from the roof you're telling. Superficial part of the submandibular gland, you have anterior belly of digastric and the nerve and vessels of the mylohyoid. We're talking about the digastric triangle. Digastric triangle is bound by anterior belly of digastric, posterior belly of digastric, and the roof, I think it's by the mandible. Okay, so you have submandibular gland, anterior belly of digastric, and nerves and vessels. Now, deep to the mylohyoid is what going to be superficial to the hyoglossus. So what you see deep to the mylohyoid is, one, you will see the deep part of the submandibular gland. Along with the deep part, you'll have the Watson's duct. Now, one nerve is going to loop around the Watson duct, that is the lingual nerve. So, lingual nerve is going to loop around that. Apart from that, you have another nerve, which is the 12th nerve. From the carotid, 12th nerve is going to come from the carotid to the digastric, because it's going to go to the tongue, right? So, it's going to, and also you have the styloglossus muscle. Now, deep to the hyoglossus, what do you see? So, we have 12th nerve superficially. What you have, see, deep to the hyoglossus is this stylohyoid ligament, and the 9th nerve. It's also going to come from the carotid, and it's going to go towards, and you'll have the lingual artery. So, these are all the contents of the digastric triangle. Cool.